My name is Rick Hodes. I'm the medical director of the American Jewish Joint Distribution Committee in Addis Ababa, Ethiopia. I've been a doctor in Ethiopia for 25 years. It's a great pleasure to be here on eTown.
How are you, Rick?
This is great. Just fantastic to be here.
Oh, good. I'm so glad. I mean, especially considering, my gosh, you traveled a fair amount of miles to get here.
I left Ethiopia Sunday morning and,
and here you are.
Here I am.
Well, so tell us a little bit about the beginning. First of all, what brought you to Ethiopia in the beginning? What did you see when you get there?
I went to Ethiopia in 1984 during the famine to work with famine victims. I went to Ethiopia for 1 year to teach at the medical school.
Yeah.
And I've been there most of the time since then,
Wow.
so now more than 25 years.
Was there something specific, or was that something you saw other than just poverty and a real need?
Yeah, I work for an American NGO called the American Jewish Joint Distribution Committee. And what happened was I was volunteering at Mother Teresa's mission, taking care of sick kids. And in 1999, I met two boys with bad backs. One had a 90-degree angle in his back, one had a 120-degree angle. And these are abandoned orphans, and I couldn't get them surgery. So I ended up adopting them and adding them to my health insurance and getting them surgery that way.
Wow.
And then another patient came along the following year, and he had a bad back, and so I adopted him. But serial adoption is probably not the answer to spine disease. So I had to come up with a better solution.
That's a wild story. That's crazy.
And now I work with the best spine surgeon in the world. His name is Ohena Boboachiaje. He's a Ghanaian who lives in the United States and goes back to Ghana all the time. I flew here via Ghana. I have 35 Ethiopian kids in Ghana for spine surgery right now. These are some of the most deformed kids in the world that we're able to turn around and make well.
That's amazing. So I'm just trying to imagine your house. Is it full of people? Do you have lots of people coming through? I mean, what's the circumstances in which you live in Ethiopia?
I actually have 4 houses.
Yeah.
And between the 4 houses, there's patients SIBs, there's orphans, and there's my immediate family. So altogether, there's about 20 people. Let me just tell you about one, because this is just a fantastic story. I have this boy who had surgery in Vancouver named Tesfaye. Tesfaye's back was shaped like a reptile, really like a reptile, for years before he had his definitive surgery. So he had his surgery in Vancouver, he came back, and then about 3 months ago, his sister shows up from the countryside. She walked out on her husband of 2 years because she wanted to live in Addis Ababa and she wanted to go to school for the first time in her life. Do you know how old she is? She's 14 years old. She had a forced marriage at the age of 12. She made her way to the city, and now she's living with us.
Wow. Wow.
So we're able to give her a house. We're able to pay her school fees. She's living with Tesfaye and going to school.
Yeah. And so this is an area of expertise that you focus on, which is spinal issues, and I'm sure there are a wide range of health care challenges and issues that you deal with, right?
Yeah, the other thing that I deal a lot with is kids who have heart disease, because nobody was treating them for free before. And I started treating them myself, and then I was sending them to India for surgery. So we can get a spine surgery now for like $20,000, while in America it would be $300,000 to $500,000, and in India we can get a heart surgery for a few $1,000s.
Wow. So, how do you fund all this stuff if you don't have all your patients on your insurance policy? I suspect.
Not yet.
Yeah. And so how do you pay for all these?
I have a website. People donate money.
Yeah.
Yeah.
I suspect that the word is out, so probably word is spread far and wide that there's this crazy guy who's just doing all this amazing surgery, and he's based in Ethiopia, and if you get there and you find him, he's likely to help you.
Yeah, and people come all the time. I mean, 2006, when we officially started our JDC spine program, we got 20 new spine patients. 2012, we got nearly 300 spine patients.
Wow. So the word is out, and the need is there.
Oh, tremendous.
Now, why is it there are so many deformed spines in this country? Because
we don't know. Part of it is because we have another disease that we don't have here in North America called tuberculosis of the spine, or Pott's disease. So a lot of my patients have Pott's disease, and some of them just have scoliosis gone wild.
Yeah. So if you're getting more and more patients all the time and you're having such success, are you getting more docs to help?
I'm working on it. In fact,
Yeah.
now we want to eventually put up our own spine center in Ethiopia. But right now we're sending our spine patients to Ghana. We have some American doctors coming in, and now we want to start sending some to India as well.
Rick, I can't help but notice your hat. And for those listening on the radio, I should describe this striped, bright-colored, blue, white, yellow, beautiful woven hat that you're wearing. I take it that's not typical MD attire.
No, they didn't issue this at the University of Rochester.
Yeah.
At Johns Hopkins. But my patients in Addis Ababa make these hats, and they give them to me. And they say, when you go to America, wear our hats. So whenever I do something like this, I wear one of their hats. So this is made by people with spine disease in Ethiopia.
Oh, cool. That's great. I mean, it's a look.
Yeah.
Yeah.
It's a look.
But it's a great story, too. So when did you start all this?
I met the first 2 abandoned orphans that I adopted in 1999.
99. And how many kids do you think you've treated since you've been at this?
I've treated several thousand kids, 4,000 kids, I'm sure.
Yeah. And you imagine that this is going to continue and grow and
It's growing.
Yeah.
It grows every year.
Yeah. And is there a website? Yeah, I guess you mentioned you have a website.
I have a website, rickhodes.org.
And spell your last name?
Hodes.
Yeah, rickhodes.org. And there are photos and videos and all that stuff on there?
All that good stuff.
Yeah. Well, I think it's a great story, and I think it's really inspiring. The band Pickwick was talking about how they tried these other things, and they found a certain combination of music and inspiration that helped them find their spot. And in a way, it sounds like a similar thing happened for you. You got to Ethiopia, you saw the need, you found the opportunity, and you found your spot, and you stayed.
Yeah, I stayed. It's been 25 years now.
Yeah, it's a very inspiring story. I'm really glad you're here to share it with us in person. Thank you so much for traveling this way. We've got a framed E-Chievement Award certificate for you to share with all your volunteers and staffers. And meanwhile, I hope people will go to your website. Once again, that's rickhodes.org, and learn more about your story.
Great.
Congratulations, Rick.
Thank you.
Winner of this week's E-Chievement Award, Mr. Rick Hodes. Physician, humanitarian, doing great work in Ethiopia. Thanks, Rick.